If you have these symptoms, you might consider a hip replacement. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Hip replacement is a surgical procedure to replace your hip joint with an artificial one, metal and plastic. It's used most often when arthritis has worn away the cartilage in your hip joint. It can also be used to treat other conditions, bone tumors and fractures. Now, there are some signs that you have arthritis and could be approaching the need for a hip replacement. Although, at the end of this video, I'll share my personal philosophy about arthritis and hip replacement. But first, if you have severe arthritis in one or both of your hips, the most common cause of hip arthritis is osteoarthritis, a degenerative joint disease. It's more common in older people, but it can strike younger people who are very active. If you have severe pain that keeps you from doing your daily activities, that causes you to limp, see your doctor right away. They'll determine basically the status of your cartilage through physical exam and x-ray and give you a good sense of how bad the arthritis is. If you're experiencing pain in your hip and it's difficult to move around as well as you could before, you may notice your pain's now worse with walking and climbing stairs. Maybe your pain's not improving with treatments like physical therapy or anti-inflammatory medication. That's probably the most common indication most joint replacement surgeons use: significant arthritis changes on x-ray and failure of physical therapy and anti-inflammatory medications to relieve pain. If you're experiencing any of these symptoms, it can be important to talk to your doctor about all your options. He or she can help you determine if surgery is right for you or if there are other treatments that might work better. Now, I'm a big believer in helping people with arthritis avoid joint replacement surgery. While hip replacements do help many people, a significant percentage have issues even up to a year later, and they're unhappy with their outcomes. And even if the surgery and recovery go well, the patients often struggle to do the activities they want to do. That's why I use a comprehensive approach that involves a number of different treatments to try to stop the damage of the hip, support and strengthen the surrounding muscles, tendons, and ligaments around the hip, and rebuild the cartilage and bone. My goal is not to just decrease your pain, but to allow you to do what you love to do as absolutely well as possible. I'd love to hear about your hip injury, your hip arthritis, and the experience with that. Leave those in the comments below. Just understand, if you leave a question for me in those comments, I can't offer you medical advice, but I might answer your question in an upcoming video. Make sure to subscribe to my video channel. Click the bell to be notified when I release a new video and start another live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.